Good morning, students. Today we are going to discuss about the external ear. The external ear it is consists of auricle and external acoustic meatus. Coming to this external ear, you need to identify from where to where it is extending. Let me show you these pictures one by one. Yes. So here you can identify an auricle, or it is also called as pinna. So auricle or pinna, it is a trumpet shape, trumpet-like undulating projection from the side of the head and collects the sound vibrations from the air. So the external acoustic meatus extends inward from the bottom of the auricle. Here you can see the bottom of the auricle. Then it is extending inside up to the tympanic membrane. So here I am showing you the external auricle, external ear. In this external ear, we can identify the auricle. So it is extending outside. It is a trumpet shaped expanded part, and inside it is going towards the tympanic membrane. Here you can identify the tympanic membrane. So this surface is called as lateral surface of tympanic membrane. So this is how the external ear is extending. Okay, then the auricle is essentially composed of skin covered, then single piece of yellow elastic cartilage which is continuous with the cartilageous part of external acoustic meatus. The cartilage is however absent in the lobule. Here you can see the lobule, the lower hanging part where usually the earrings they pierce. This part it is devoid of cartilage. There is no cartilage is present in this lobule. Then this is about the external part of the ear, external ear. Then what are the features of auricle? Let me show you this. What are the features of auricle? Now let me show you the parts of auricle, the features of auricle. So if you observe the auricle, this lateral surface of auricle, it is irregular and presents a concavity facing forwards and laterally. It displays the following elevations. Here you can see the elevations and some depressions. Let me show you, let us see the what are the elevations and what are the depressions called as. Then we can write in the first elevation which is present outside, that is called as helix. This outside rim it is called as helix. Helix it forms a prominent peripheral rim. Its anterior limb is descending as the crus. Okay, crux of the helix into the concha. So this anterior limb of the helix is extending downwards and it is extending as the crus of the helix. This part is called as crus of the helix, and into the concha. This part is called as concha. Concha. So this concha divides the latter into upper smaller area and lower larger area. So this concha is dividing this area into concha into upper smaller, lower larger areas. Okay, and on this helix we can identify a small tubercle called as Darwin's tubercle or auricular tubercle. This is about the helix, outside peripheral rim called as helix. Then antihelix. Now we are going to see the antihelix. Exactly in front of the helix, in front of this peripheral margin, we can identify another projection called as antihelix. Antihelix. It is parallel with the helix. It is partially encircles the deep depression. Okay, it is partially encircles the deep depression. Then the concha of the auricle, it is covering the concha. This space is called as concha. This concha is covered by this antihelix. Then this antihelix divides into two crura. Here you can identify this antihelix is going to divide into two crura. Okay, and here we have seen the crus, and here we are identifying crura. So the helix is extending as the crus, and antihelix it is dividing or diverging into crura of antihelix. Okay, so then we can identify a narrow gutter between the helix and the antihelix. Here you can identify a narrow gutter between helix and antihelix. This depression is called as scaphoid fossa. This depression is called as scaphoid fossa. And between the two crura of antihelix, the triangular area, this area is called as triangular fossa. Triangular fossa. The depression of the concha is guarded in front by triangular flap of cartilage known as tragus. So here you can identify in front of the crus. Okay, in front of the concha. Sorry, in front of the concha, we can identify a triangular elevation. This part is called as tragus. Tragus. Opposite the tragus and separated by intertragic notch lies another triangular elevation called as antitragus. Antitragus. Okay, let me show you first the tragus over here. Okay, here's the tragus. Exactly opposite to this, you can identify antitragus. So far, what are the structures we have seen? First one is devoid of cartilage called as lobule, then peripheral margin called as helix, and this helix is extending as crus of helix. Then in front of the helix, you can identify antihelix. This antihelix, it is also an elevation. Helix also an elevation. So antihelix is extending and it is going to divide, and this depression is called as triangular fossa. Between the helix and antihelix, scaphoid fossa. Scaphoid fossa. And here we can identify the concha. Concha above smaller area, below lower larger area. Okay, so then we can identify another elevation exactly in front of this external acoustic meatus, that is called as tragus. Opposite to the tragus, antitragus. Antitragus. Between the tragus and the antitragus, you can identify intertragic notch. Intertragic notch, where we can identify so many hair follicles which are present over here. Okay, that is about the structures which we can identify on the external ear. So this lobule of the ear, where we can identify here the hanging projection, this lobule of the ear hangs below the antitragus, then as the skin covered the flap of fibrofatty tissue, fibrofatty tissue. Then other structures what we can identify. Let us see the muscles of auricle. Okay, so here in this image, I'm just showing you how the external ear. So the external ear extending from. So here you can identify the bony part of external acoustic meatus, and here you can identify the cartilaginous part. So entire this part extending from outside to inside, it is extending. Outside you can identify auricle. Inside you can identify lateral surface of tympanic membrane. So this is the extension of external ear. So in this external ear we have discussed about the external part. External ear we have discussed. Now we are going to see what the muscles are present in this. So what are the muscles we can identify? External muscles include auricularis anterior. Auricularis anterior. Here you can identify in front of this one. We can identify auricularis anterior, that we will see. Excuse me. So we are discussing about auricularis anterior, superior, and the posterior. So these are the extrinsic muscles. So in this picture, we can identify auricularis superior over here, auricularis superior, and then here you can identify auricularis posterior over here. Okay, so auricularis superior also you can identify over here. So these are the muscles you can identify, extrinsic muscles of the auricle. Then these three muscles arise from the epicranial aponeurosis. I think you might have remember the epicranial aponeurosis. So the epicranial aponeurosis is the third layer of the scalp which is extending downwards and it is reaching to the superior border of zygomatic arch. So from that epicranial aponeurosis, this auricularis superior, auricularis posterior, and auricularis anterior, which are arising, and then they are inserted into the spine of the helix, and to the upper part of the cranial surface of auricle, respectively. So the posterior muscle arises from the mastoid part. So here you can identify the auricularis posterior, which is arising from the mastoid part of temporal bone and is inserted into eminentia concha, inside part of the concha, which is inserting. And the nerve supply of this is by the temporal branch of facial nerve, and the auricularis posterior by posterior auricular nerve. So this auricularis posterior is supplied by the posterior auricular branch of the facial nerve. So these are the extrinsic muscles of the auricle or pinna. Then action. What is the action is extrinsic muscles move the auricle. These moves the auricle as a whole. Such movements are insignificant in mankind. Insignificant. So when you just see the lower mammals, you can identify, especially the dogs and all. When you call them, they lift their ears up. This is the because of the action of auricularis posterior, superior, and the anterior muscles. Okay, so that is about the extrinsic muscles. Then coming to the intrinsic muscles include helicus major, helicus major. Here you can identify the major muscle we can identify helicus major and helicus minor, tragicus. Here you can see the tragicus and antitragicus, and then transverse auriculae and obliquus auriculae. So here you can identify oblique auriculae, and here you can see the transverse auriculae. These are the intrinsic muscles of the auricle. So in the extrinsic muscles we have seen three muscles: auricular superior, anterior and the posterior. Then coming to the intrinsic muscles, we can identify helicus major, helicus minor, tragicus, antitragicus, then obliquus auriculae and transverse auriculae. Transverse auriculae. These are all the intrinsic muscles. Their actions to modify the shape of pinna. Their actions are to modify the shape of pinna since their actions are minimal in most of the human ears. Then what about the nerve supply? Nerve supply, it is by the temporal branch and those of the cranial surface by the posterior auricular branch of facial nerve. Okay, so the ligaments of the auricle are two sets: extrinsic and the intrinsic ligaments. Extrinsic ligaments are anterior and the posterior connects the auricle with the temporal bone. Okay, then intrinsic ligaments connects the various parts of the cartilage of the auricle as fibrous bands. These are all not we cannot see clearly even in the dissection part. Then coming to the arterial supply of the auricle, it is by posterior auricular branch of external carotid artery supplies the cranial surface on posterior part of the lateral surface of auricle. So then other branch which are supplying to the auricle or pinna is by anterior auricular branches. Anterior auricular branch. Venous drainage, it is by it drains into superficial temporal vein and external jugular vein. Then the arteriovenous anastomosis are numerous beneath the skin of the auricle. Okay, so arteriovenous anastomosis dilates in cold atmospheric temperature. Hence, skin cracks might affect the auricle in winter, and the persons find comfortable to move in cold season by wrapping the pinna with a piece of warm clothing. That is the reason what we can see in the cold temperature will cover our auricles, to cover our auricles. The lymphatic drainage, it is by parotid group of lymph nodes, mastoid group of lymph nodes, then upper deep cervical group of lymph nodes. This is about the blood supply, nerve supply, and lymphatic drainage. Then moving towards the external acoustic meatus. Acoustic meatus. Before going to see that, what is the sensory innervation of the auricle? It is my greater auricular nerve, lesser occipital nerve, auriculotemporal nerve, then auricular branch of vagus nerve, auricular branch of vagus nerve supplies the concha and eminentia concha. Okay, so remember these nerve supply, sensory innervation, greater auricular, lesser occipital, auriculotemporal nerve, then auricular branch of vagus nerve, auricular branch of vagus nerve. So these are the sensory innervation. So I'm just remembering one incident which is happening. So auricular branch of vagus nerve, which is also sympathetic so it is a nerve which is stimulating the stomach to secrete more HCl. Okay, so if you stimulate your ear with any earbud, mean external ear, if you stimulate that, it creates more appetite. It creates more appetite because of the stimulation of the vagus nerve. So which is also supplying to the stomach. Okay, that is about the sensory innervation to remember this scene. Okay, so that you can remember for a long time. Auricular branch of vagus, auricular temporal nerve, lesser occipital and little auricular nerve. Then come moving to the external acoustic meatus. So this external acoustic meatus, it extending from the bottom of the concha to the tympanic membrane, to the tympanic membrane. So it is about 24 mm in long. Now I am showing you the radiogram, and it is a S shape. You can see that. So the external acoustic meatus describe an S-shaped curve and consisting of three parts: pars externa, pars intermedia, and pars interna. Externa, intermedia, and interna. Okay, so the pars externa directed upwards, forwards, and medially. Let me show you this diagram now. Yes, moving to this external acoustic meatus. So in the external ear we have seen external ear or auricle or pinna, then external acoustic meatus. Now we are discussing about this particular part. So this external acoustic meatus, it is having three parts: pars externa, pars intermedia, pars interna, and is a S-shaped curve. It is 24 mm in long. Pars externa, it is directing upwards, forwards, and medially. Then pars intermedia, it is directing upward, backward, and medially. And pars interna, it is directing downwards, forwards, and medially. Downwards, forwards, and medially. So therefore, when you want to see the tympanic membrane, when you want to see the tympanic membrane or cavity, it's an acoustic meatus, you need to pull the auricle upwards, backwards, and laterally. If you just if you pass the light into the external acoustic meatus simply, you cannot see anything. We cannot see anything. So you need to hold this external ear or auricular pinna. You have to pull it upwards, backwards, and laterally, and pass the light through this gap, so through the external acoustic meatus lateral end, so that you can see clearly the pars externa, pars intermedia, and the pars interna, and also the tympanic membrane. So coming to this external acoustic meatus, it is consisting of cartilaginous part in the lateral one third and the bony part. Here you can see the bony part in the medial two thirds. So the cartilaginous part is continuous with the cartilage of ear or auricle. In the upper and the posterior part of the meatus, the cartilage is absent. Okay, then it is replaced by fibrous membrane. Sometimes three or more fissures of Santoroni, corniculate cartilages, small cartilages. Okay, then the bony part is composed of tympanic plate of temporal bone, below and in front, and squamous part of temporal bone, above and behind. Okay, so bony parts. Which are the bony parts? Tympanic plate of temporal bone, in front, in front, and then posterior. You can identify squamous part of temporal bone. Squamous part of temporal bone. A tympanic sulcus is present as the medial end of the medial end of the meatus, where the tympanic membrane is attached obliquely, so that the floor and anterior wall of the meatus are longer than the roof and the posterior wall. So this is about the external acoustic meatus. Another things are sometimes the anterior wall of the bony part presents a foramen. Anterior part of the anterior wall of the bony part means tympanic plate. It is having a foramen called as hiatus of Huschke, which is closed by a fibrous membrane. The deficiency of the anterior wall is due to incomplete ossification of tympanic plate. Okay, so that is about external acoustic meatus. Then the constructions which what we can identify is external acoustic meatus, and this is presents two constrictions at the junction of bony and the cartilaginous part. Here you can identify a small constriction, and at the isthmus of bony part, which lies 2 centimeters deep to the concha. 2 centimeters deep to the concha. Here also you can identify another constriction. Okay, so what are the structures are present here? What are the structures are present here are: one, we can identify modified coiled sweat glands. Okay, modified coiled sweat glands known as ceruminous glands. Ceruminous glands are present in the cartilaginous part. They secrete earwax or cerumen, which prevents maceration of the lining epithelia by trapped water, or opposes the entry of insects, and maintains a warm humid environment for effective vibrations of tympanic membrane. So that is about external acoustic meatus. Then what is the nerve supply of this is, it is supplied by roof and anterior wall are supplied by auriculotemporal nerve, roof and anterior wall. Then here you can see the floor and the posterior wall, they are supplied by auricular branch of vagus nerve, auricular branch of vagus nerve. It is also called as nerve of Halderman, nerve of Halderman. Okay, so that is about external ear. Okay, thank you students.